So we're going to do a really quick review of the most important tests to know, and these fall in the realm of objective, projective, intelligence, culture fair, neuropsychological, and then specific symptoms assessments. I want to go through very quickly the ages for these. So the objective tests to know about are the MMPI and the MCMI. The MMPI is for adults, and the MCMI is as well. So these are personality, well, not just personality, but they're meant for diagnosing the DSM. They're for grown-ups. Projective tests, however, the Rorschach can be used from age 2 and older, and I'm not sure about the thematic apperception test, but there's a lot more room, of course, with a projective test for it to not be dependent on age. With measures of intelligence, the two to know about are the WAIS and then Stanford-Binet. So if you were to ask yourself right now which one is for adults over 16 and which one can be given to individuals as young as 2, which would it be? And the answer is that the Stanford-Binet is from 2 to 85 plus, and the WAIS is 16 through 90 in 11 months. For whatever reason, they cut it off there. There are renditions for kids, but these are the two to know about, and the WAIS is for adults. In terms of culture fair tests, these tests make use of nonverbal format, and we have the Leiter International Performance Scale, and we have the Raven's Progressive Matrices. So understandably, with the objective personality sort of diagnostic DSM test, you had it for adults. With the projective, they were kind of all ages. Intelligence, you saw you had multiple forms, different ways of using the same form with the Stanford-Binet to get a wide range. So think what you would expect with a nonverbal culture fair test. So hopefully you would expect that there's a wider range just built in already, and that's true. The Leiter is the card matching test that assesses fluid intelligence, and in 4 different domains: visualization, reasoning, memory, and attention. And that can be from ages 3 to 75 plus. The Raven's Progressive Matrices, it's a nonverbal measure of general intelligence, so fluid intelligence for Leiter and general intelligence for Ravens. This is the matrix reasoning, and this from 6 years and older you can do. And of course, they've made one for younger kids, but 6 years plus. This can, just as a side note, can be used with hearing impaired and people with aphasia or physical disability. In terms of the neuropsychological test, you have the Halstead Reitan battery, the Luria-Nebraska battery, and the Bender-Gestalt. So think to yourself what you would expect in terms of the ages for these. So with the Halstead Reitan and the Luria-Nebraska, they are generally for adults. However, the Halstead Reitan created an extension from 5 to 14, so it's supposed to be 16 plus. And then the Luria-Nebraska did a similar piece. They made they made 2 different forms. So they are similar tests, but they have either an extension or 2 forms. Now, what's the difference and how can you remember it? So the Halstead Reitan is just about differentiating between normals, quote unquote, and those with brain damage. And the Luria-Nebraska is actually testing specific skills that are impacted by brain damage. And there's 11 different subtests, and you get scored from 0, 1, or 2. So it's like things like visual, reading, writing, math, touch. So it's just kind of all over the place, but you can actually kind of zoom in. So that's how the Halstead and Luria are very complementary, actually, but you would start with the Halstead Reitan. The Bender-Gestalt test. This is the one that is stimulus cards with geometric figures, and you copy them. And this is just meant to be a screening device for impairment, for neuropsychological impairment at all. So if you had to make an order that you would give them, it would probably be the Bender-Gestalt. You see that there's some impairment, you go to see if there's brain damage, you give the Halstead Reitan. you see there is. And then finally, you want to know what skills were impacted, and you would go to the Luria-Nebraska. The Bender Visual Motor Gestalt is for ages 3 and older. So all of the neuropsychological tests are accessible to all ages. Besides infants, but that's silly to be giving them these kinds of tests anyway. But the Halstead and Luria have different forms and extensions to incorporate those under 16. So finally, we have a few different checklists that are kind of the most important ones to know that don't fall in these categories of, projective, objective, intelligence, and neuropsychological. And those are the Beck, the Vineland, and the Activities of Daily Living scale. And that's because the Beck Depression Inventory is so quick to give. It is, if you had to guess the ages, it's for 13 years and older, because depression in children actually looks very different than it does in teens and adults. So it really wouldn't be appropriate to give it to kids. I think that can be pretty intuitive, actually. If you want a trick to remember the cutoff scores for depression, so the items go from 0 to 3, and 0 to 13 is minimal, 14 to 19 is mild, 20 to 28 is moderate, and 29 to 63 is severe depression. So I don't really think this is true, but one way to remember would be like childhood is this very happy time from 0 to 13 years old. And then you hit teenage years and you get angsty and depressed. So you go into your mild depression. And then you get into your 20s, which, truth be told, is kind of fun. But let's just say 20 to 28, you're realizing the harsh realities of life and responsibility. And then you near 30. And so from 29 to 63, you realize that death and suffering are real. I'm just being silly. But along with Erickson's model, as you get past 63, if you can achieve your different developmental stages, you can come to a place of wisdom. And then all the depression is gone once you get past 63. So that's one way to remember. Vineland and ADLs are the other. So Vineland is really important. I mostly associate with intellectual disability, but it can also be helpful with autism, ADHD, dementia, brain injury. So you can see that there's kind of cognitive neuropsychological problems here. But this doesn't evaluate the neurological dysfunction itself. What it does is it evaluates your personal and social skills. And this could be from birth to age 90. The purpose of it is to really help develop an education and treatment plan. So with intellectual disability or ADHD or autism and such, usually learning needs to be tailored. So if you can understand their communication, their daily living, their socializing, and their motor skills, that these 4 areas, if you can understand them, you can really tailor education to them. And finally, ADLs, activities of daily living. These are the routine activities and tasks of everyday life, and you need them to basically just be able to take care of yourself and be independent. An assessment of them is really essential. So there's 2 cases where you want to start thinking that ADLs are important to look at. One is evaluating legal competence, and also it can be helpful with individual dementia to identify interventions, to monitor, and to evaluate outcomes. 2 examples, by the way, are Nottingham Extended and Lofton Instrumental activities of daily living scales. But what we want to know about most importantly are the MMPI-2 and MMPI-2RF, as well as the MCMI-3. The age range, you need to be over 18, and you want to interpret a T-score of 65 or higher as clinically significant. There are different kinds of profiles, which is kind of fun. So you have your different 3-point scales. So let me see if I can find some here. There's a 2-point code of 4-9 or 9-4. And that is acting out behaviors of people with a history of marital problems, alcohol and drug abuse, delinquency. There's also the psychotic valley. So that's more fun than that 4-9 thing. But that's 6, 7, and 8. And that's associated with delusions and schizophrenia. So psychotic valley is one to remember. You want to remember the F scale, and the L scale and the K scale. L is the lie scale, K guardedness, and F is fake bad. Fake good? Fake bad. I think fake bad. The MCMI, this will assist in DSM diagnoses more than the MMPI, which is more personality and personality disorders even. I mean, it's not just that, but the MCMI, you're going to get a little bit more into just helping with DSM directly. And it can be Axis 1 and Axis 2. Just to be clear, there's an adolescent version, BTW. Projective personality tests. 3 ones to know about would be the Rorschach, Projective, and Thematic Apperception. The Rorschach is 10 Inkblot cards, 5 are achromatic and 5 are color. You need to be above 2 years old, so not too stringent with the age requirement. And it's supposed to obtain information about your personality structure that you could use with diagnosis and treatment planning. Most scoring interpretation systems. Thematic Apperception Test, the TAT, wide-based measure of personality, and it's really trying to get at your cognitive style, emotional reactivity, and defensive structure. It's based on Murray's theory of needs, and what you do is you're shown these images and you make up a story about each of the picture. The way they score this is by first identify the hero and evaluate the nature of the needs and outcome in the story. So what are the needs of the hero and what is the outcome of the story? Intelligence tests are used for a variety of reasons, like scholastic aptitude, educational, occupational counseling, diagnosing intellectual disability, learning disorders. They most often yield more than one IQ score, and the deviation scores indicate how they do in reference to the norm or standardization sample. The WACE is for 16 to 90 years old. It has 4 indexes and a full scale IQ if you wanted to. The Stanford-Binet is a little bit different, and it really is modeled after the Cattell-Horn-Carroll model of intelligence. So just to go a little more into the WACE pretty briefly, honestly, it's based on Wechsler's view of intelligence, that there's a global ability comprised of the interrelated functions which allow them to act purposefully, think rationally, and deal effectively with the environment. It provides the full-scale IQ, and then the index score, so this could be helpful to know, is working memory, processing speed, perceptual reasoning, and finally verbal comprehension. So, memory makes sense. Being able to process makes sense. Understanding words makes sense. And then I guess perceptual reasoning would be the one that I would have more trouble remembering. But if you just think about the block design piece, that's definitely a perceptual reasoning, and that's certainly key to understanding intelligence. Mean of 100, standard deviation 15. Subtest scores have a mean of 10 and a standard deviation of 3, so that's interesting. There. The Stanford-Binet, this is appropriate actually for a much wider age range. It is divided into verbal and nonverbal domains that measure the same 5 cognitive factors as seen in the chart. Are similar. I mean, it's similar in terms of scoring with it is tailored to the examinee's level of cognitive functioning through the use of routing and functional subtests. Administration begins with the 2 routing subtests. So the object series matrices, which is nonverbal, and vocabulary, which is verbal. And the starting point of these subtests is based on the examinee's age or estimated ability level. So administration of each of the functional subtests begins at a level slightly below their ability as determined by their performance on the routing subtest. Testing for each subtest continues until the examinee reaches their ceiling, which is determined by the designated number of consecutive errors. And I would guess scoring and interpretation is also important to know. This can be hand-scored or scored using computer software. Subtest scores, mean of 10, standard deviation of 3, are combined to obtain 4 types of composite scores. You have fluid reasoning, mean of 100, standard deviation of 15. The full-scale IQ, a factor index. So there's more of an emphasis on reasoning. Domain and
there with
abbreviated
those
battery
fluid and
IQ.
quantitative ones.
Change
And then they
sensitive
also just
scores
want to
can
know that
also
you
be
know stuff.
calculated. These scores allow
So that's
criterion
the
reference
knowledge.
interpretation of an examinee's performance in terms of developmental
each of
level
these,
and
they
complexity
look
of the task, and are
non-verbally
useful for
and
evaluating
verbally. So I
examinees
guess
at extreme levels of ability
it's a little
and for
different
tracking
than
changes in
instead of
performance
having one
over
index
time.
that's verbal, you
So
have
important to
the
remember
nonverbal and
that
verbal
the
on all 5 of these
subtests
cognitive
are
factors. So that's
combined
pretty
to get the full scale IQ, and then you have a factor index that includes each of the 5 domains, so then you get to look at the verbal and nonverbal, and then you can look at an abbreviated battery, which is looking at the routing subtest actually. Psychometric properties. The standardization consisted of 4,800 people aged 2 to 96 years old, stratified to match the census in terms of gender, ethnicity, geography, socioeconomic. An additional 1,365 people represented special groups, intellectual disabilities, learning disabilities, hearing impairments, attention deficits, etc., and they were included in the sample. Internal consistency reliability coefficients for full-scale IQ, nonverbal, verbal, and factor indexes are all above 0.9, while coefficients for the subtest ranging from 0.84 to 0.89. Evidence for the test content, criterion-related, factorial, and consequential validity is provided in their technical manual. Most culture fair or culturally sensitive tests have reduced cultural content and make use of a nonverbal format to overcome the cultural loading associated with language. These tests must be used with caution, however, because there's evidence that they may be just as culturally loaded as traditional tests, and actually less valid as predictors of academic achievement and job performance. The 2 main ones that we will talk about is the Leiter International Performance Scale and the Raven's Progressive Matrices, which is typically considered the closest to a culture fair test as you can come. The Leiter International, this is for, I don't know, it's for age 3 to 75 plus. And this is for particularly if there's language or hearing problems. So now that's that makes sense, right? Why this would be an important alternative to have, because you simply can't very effectively use the WACE in that case. Raven's progressive matrices are really interesting. I have a hard time believing that they are culture bound. I think it is considered, it is considered a culture fair test, because really here you just look at different designs in a matrix and choose which one should fill in the blank. You can use it with people who are hearing impaired, non-English speaking, and even with folks with aphasia and or physical disabilities. Let's move into the neuropsych tests. There's 3 primary neuropsych tests to know about. Can you name the 3 neuropsych tests? Because we don't do a lot of this in clinical psychology school. So what are they? And how can you remember them? So there's one that has to do with Nebraska. That's the Luria-Nebraska battery. The Bender visual motor gestalt is often given with the WACE, like the mini mental status and the WACE are given together. So you might know that one. That's where you copy the stimulus cards. And the Halstead Reitan is another one. And that you'll have to come up with a way to remember it. So the Halstead Reitan and the Luria-Nebraska, these are the 2. So the Nebraska one, maybe you can remember the state of Nebraska. I don't know why. You come up with a good reason. But the Halstead Reitan is specifically to detect brain damage, and the Luria-Nebraska will assess, has 11 subtests that assess different skills that are affected by brain damage. So you can get sort of normal, borderline, or clearly abnormal performance on any of these. And you're going to get a score on 14 different scales at the end. So this can really give you some detail here in terms of what kind of brain damage there is or isn't. And there's different forms available for different ages. The Halstead Reitan has been found to accurately differentiate between normals and those with brain damage. So this is not as much to give you a detailed breakdown
of domains, but it can start to point out the level of impairment, and if there is brain damage. You probably will end up using it in conjunction with other tests. The Bender-Gestalt, though, this is just a brief measure. You can be 3 years old, plus you look at cards, you copy them, and then you draw them from memory. It's a valid screening device for impairment, and you can use it to track developmental changes, but it's not so useful with the psychiatric piece.
There are a number of inventories available to assist in the detection diagnosis of a wide range of problems and for treatment planning, monitoring, and outcome assessment.
Behaviors and abilities. The assessment of depression and suicide, see if you can remember what scales were used there. So Beck Hopelessness Scale and the Scale for Suicidal Ideation Risk. And then there was a third one that we mentioned at a different point. Can you remember what that third scale was? So if you can't, go look it up. The Vineland. So here's one that's actually important to remember, where we're kind of getting into more obscure tests, which you still want to know. But the Vineland is really important because this is used very frequently to assist in the diagnosis of severe disorders, including intellectual disabilities, autism spectrum, ADHD, dementia, and brain injury. It provides an adaptive behavior composite score and then 4 domain scores. Can you name the 4 domains? And just think, what are some basic things that are necessary for adaptive daily living? Well, you need to be able to communicate. You need to be able to socialize. You need to be able to actually have, solid motor skills, fine and gross, and then just daily living things like personal, domestic, community. Yeah. Interesting. So ADLs, that's a term that if you were to work at a elderly care facility, you would hear a lot. But these are activities of daily living, and so things that are necessary for everyday life. BADLs, that's when you're getting to the personal care and mobility. The IADLs, that's independent living. And really, an ADL assessment is essential to determine things like legal competence and also to determine interventions for folks with dementia, because there can be a point at which they are not able to really take care of themselves. You could imagine with grave disability assessments that this would also be factored in. There are different scales, including the Nottingham Extended Activities Daily Living Scale, the Lofton Instrumental Activities. So there's different ADL measures that you can use.